Friends, the treatment of prostate issues is known to all. In other words, prostate, a male gland which undergoes a hormone change progressively and very gradually over years and over decades, brings about a blockage of the urinary passage. And that change catapults another kind of a change upstairs. And that's where we need to discuss that. What happens is the urinary bladder, whose job is to store urine that comes from the kidneys and then push and empty urine out. So dual functions. Changes in background of a gradually obstructing prostate. What do you and I do? We look at the prostate size, we look at health checkups, and look at the measurement of size of the prostate. The prostate may be 20 grams, or maybe 40 grams, or maybe 150 grams. The change in prostatic size is a lot related to our hormone changes happening internally, the testosterone, which converts itself into dihydrotestosterone. And that entire mechanism of change brings about growth in the prostate that is called as BPH, pathological term, benign prostatic hyperplasia, or a benign enlargement of prostate as a clinical term. So these are all medical terms which are denoting that there's a change happening in late 40s, 50s to all men. Everybody goes through it in different angles and at different levels altogether. So all men are going through changes in the prostate is what is the first message that we need to pass here. Number two, the prostatic change catapults a change in the urinary bladder's function. The bladder all this while was storing urine, and when you wanted to pass urine, you would go to the washroom, the bladder would contract and push urine out, and the urine would come out through the prostatic urethra or the narrow pipe, which starts from the bladder neck and goes all the way to the male organ. Because the prostate is gradually obstructing the urinary passage, again, very gradually, that you and I cannot see and measure and decipher because it's very progressively slow process. The bladder undergoes a change in understanding the resistance created. And that's where it's a progressive resistance which the bladder has to compensate for. So compensation is by contracting more and contracting more, while the obstruction is increasing, the contraction is increasing too. So bladder is overworking. That's the entire story for all of us. The bladder is overworking morning, evening, night, all the time, though it may be contracting only 5 to 7 times for you every day, once or twice at night to push the urine out. The contraction of it mechanism is changing progressively. And this is where we need to discuss what is happening internally and why this project. The project is save the urinary bladder, save the bladder. How do you save it? You save it from this overwork, which is a repeated process all through day and night while you adjust and you probably don't complain. Because you will complain at a point in time when there will be significant decrease in the urinary flow, which you decipher is probably wrong compared to what it was in yesteryears. And that comes very slowly in men in their busy life and quite busy times in 50s, 60s, and 70s. When they pick it up, it's too late. And when we treat them with some medicines, they get a mild result and they're okay with it. So let's study that part. So prostatic occlusion or obstruction is treated with medicines from the family called alpha blockers, where the medicines bring about a change in the flow of urine. So your flow improves. You're complaining of obstruction to the flow of urine, flow is gradually going down, and you're complaining about it. We have brought about a change in the flow by giving you a medicine, and you're happy about it. And then what happens is you probably disappear. You're okay with the medicine, you continue the medicine, and your doctors in any specialty, it could be physicians, cardiologists, general practitioners, gynecologists, urologists, would say continue the medication. They need to reassess you after an interval, which could be 3 months, 6 months, an year, or maybe earlier if you are heavily symptomatic in terms of obstruction, and accordingly make changes in medication, escalate or de-escalate as required. That does not happen. People continue taking medicines for months, years, and even decades, and one fine day, that the progression is already on to what we discussed in the first part of the discussion. People undergo a change in the urinary bladder. So the bladder undergoes that progressive, irreversible change is what we're talking about. I've told this before that when I turn 55, I cannot turn 54 anymore. When it becomes 2025, it will never be 2024 anymore. The bladder once undergoes these irreversible changes of contraction, overworking, which you measure as thickened bladder wall, which we measure as trabeculations and diverticulae formations, and the bladder's emptying mechanism gradually going down. The bladder may turn from a capable contracting bladder to progressively contracting too much as a result of the obstruction to compensate it. And you may have this urgency, frequency, urge incontinence at times as a male. You would go and pass urine more frequently, but the bladder is not urging you to go, only because now it's scared things should not go wrong because obstruction is progressive. And sadly, that's not visible to you and me because we are worrying about the prostatic size. So we are shooting in a different direction. We're looking at 20 grams prostate or 40 grams prostate or 100 grams prostate, which only a urologist would decide as to what is the entire lower tract entity. That functionality or dynamics are changing completely. And that's what is slow and progressive. So, friends, this is a wake up call. Urinary bladder is undergoing a progressive, irreversible change, and its function is pivotal to your urinary flow, the less younger age or the older age. That's where the bladder should not become non functioning, poorly functioning, not able to contract, and become a hypotonic or acontractile or atonic bladder. There's not much answer to that, the whole world right now. So if the bladder becomes irreversibly non-contracting, does not contract and empty, I think the story is over. The bladder will never push urine out. And if you don't get up and move, even if the door is open, you will never reach outside. So bladder undergoing a progressive change over months and years and decades is a huge concern, but silently under the carpet. Nobody talks about it. So we measure it by some rough parameters like thickened bladder wall trabeculated, but the better measurements are a uroflowmetry, which gives you the pattern about not the bladder contraction, but the entire performance. I call it as a report card or ECG of the bladder when you do a uroflowmetry or your flow patterns, which again, as I said, is very silently and progressively changing. It will change in a year or change in a decade, but that change can be deciphered and picked up by a urologist. He can pick it up, he can evaluate you, can go forward, and if he has doubts, does the test called urodynamics. The test which tells us about the bladder's contractility index, the bladder outflow index, things which are talking about the irreversible change which can actually be troublesome. And that's where the whole story is. So, friends, while we treat prostate, while we all have been hammering the organ, which actually has got two different changes on one side, enlargement, occlusion, and therefore a benign change, on the other side, a small subset of people undergo a change towards cancer. We are looking forward to upstairs the bladder, which is an organ, a receptacle that is changing its function almost to irreversibility to be stabilized. And that's where comes this entire project called Save the Bladder. Save your urinary bladders from trouble for future by seeing your urologist in your cities, in your locations where you stay in time. Identify yourself by the urinary flow that you know. If the flow is that speed, it goes to the wall, great. It doesn't go that way. It probably falls closer. The speed is shrill, narrow, thin, takes time to start, takes time to empty. When you leave the washroom, you are dissatisfied. You're not emptied it completely. If all these are your stuff, you need to probably look at IPSS symptom score, International Prostate Symptom Score. Download it and probably look at it. IPSS symptom score tells all about yourself. It tells rating of your bladder. It rating of your prostate. So know your prostate and obviously therefore you know your bladder. Because the bladder's visibility is not visible to all of us. So if you are in an IPSS symptom score mind, be aware that you can climb to moderate and severe, which is what you won't let yourself climb. Your concerns, even if mild, needs to be known to your urologist. And once he knows it, he probably looks at the right medications around. So medicines only work on the prostate. They can only do this much. And that change makes you feel happy and comfortable and you continue the medication. While the change of irreversibility is already on because of the bladder having to overwork around. So this assessment is completely individualized. It cannot be generalized. And this assessment is extremely important. I speak to you from the Kokilaben Dhirubhai Ambani Hospital in Mumbai, looking at this aspect of care and understanding, which is probably so deep, hidden, obviously so concealed that it probably will not be visible to many clinicians, many doctors in the busy practice. Obviously, you and me in our busy lifestyle, morning till midnight, will miss it out. And the change is progressive and happening. So, friends, save the urinary bladder. Don't let the bladder go through this trauma of contracting irresistibly to be able to empty, which it was so smooth in your yesterday decades. Remember, 10s, 20s, 30s, and even 40s, you could pass urine onto the wall. You could paint and probably pass and paint your name on the wall. That era has gone. Changes are happening very progressively, and we need to prevent that happening. And therefore, this entire talk comes over for us to be awake that if my flow is not good, if my flow is poor, if my IPSS symptoms goes moderate and severe, I will still not be continuing to eat medicine around. Our job is to relieve the obstruction, relieve it close to permanency. A permanency of 5 years, 7 years, 10 years, 12 years is good enough to be able to hold back the bladder's irreversible change for the next time to come in. It's important that this message goes to men. Men probably never know it. Doctors miss it out because obviously the busy practice where you are wanting to be treated to what you want. And probably this is completely missed out, not only in India, all over the world. So Save the Bladder is a project. This project will bring about continued stability of the urinary bladder while we treat the prostate. So with treating the prostate, can we give it some kind of a deobstruction early enough, which would actually not affect the bladder? And that's where we are in. Thank you so much.